Hi everyone, Dr. Ariel Ostat, cosmetic dermatologist. I want to talk to you about a treatment option for patients with diffuse precancers. It's something that I see, unfortunately, in my older patients. Let's talk about what precancers are. Precancers are basically defined as these scaly, rough spots that develop on sun-exposed areas, primarily on the face. So it could be on the forehead, nose, temples, cheeks, chin. And it's something that they basically comes and goes. So these red spots sort of disappear, they come back. Patients complain that they can be scaly, dry, they look like dry lesions, but they're actually not dry spots, and occasionally they can itch or be a little bit tender. It is so imperative that these precancers are diagnosed early, because otherwise a certain percentage of these can go on and become common skin cancers, which then require surgery. If an isolated lesion is there, we can actually do a simple treatment like what we call cryotherapy. But if a lot of patients present with diffuse lesions, and there are a variety of ways to treat that, whether it's with topical creams like what we call 5-fluorouracil, which has unfortunately some downtime for a few weeks, versus a commonly utilized technique in my practice, which is called photodynamic therapy, which I like so much because it allows us to actually eradicate these precancers with very little recovery. Just in a nutshell, it's a treatment where we apply this, what we call photosensitizer. It's alpha-levulinic acid, which basically sits on the patient's skin for an hour while the patient stays in the exam room. And then afterwards, we expose the skin to what we call blue light for about 15 to 17 minutes. That photosensitizer gets activated with the blue light, and it's actually able to selectively target those precancers. The recovery is really quick. Patients typically for about a week have some rough spots, but it's something that doesn't require staying home, unlike those other treatments with creams. Patients are a little bit sun sensitive for the first couple of days, so it's important to wear your sunscreen, but usually a series of 2 to 3 of these treatments does an incredible job of getting rid of precancers. Ironically, we can use this treatment also for acne, for treatment of aging, getting rid of brown spots, and stimulating collagen. Again, it's called photodynamic therapy, otherwise known as PDT. Thank you.